Welcome to Good Morning Morocco. I'm Jalal Jihazi, live from Morocco English Radio. Today we are honored to host a special guest at our studio, Professor Omar SEFRIOui, the president of the Moroccan Society of Reproductive Medicine and Fetal Medicine, and recently nominated as president of the Mediterranean Society of Reproductive Medicine. Professor SEFRIOui, welcome to Morocco English Radio.
Thank you, and I'm very delighted to be here with you.
Thank you. Before we kick off our discussion today, can you introduce yourself, Professor, to our audience?
I'm doctor. I'm professor. I was professor in the University of Casablanca, Morocco, Hassan II. And my special field is probably infertility and reproductive surgery. Well, my field has been developed since I had probably the chance to work in some other countries, because as you know, infertility was not very developed in Morocco some decades before. And I worked in the USA and also in France for a year and a half in a very good hospital center, and also for reproductive surgery. 7 years ago, we decided with some colleagues to found the Moroccan Society of Reproductive and Fetal Medicine, and we worked since then in continual medical education in infertility and reproductive surgery. And as you said, recently I had the honor to be elected as the chairman of the Mediterranean Society of Reproductive Medicine, which is a society that had been founded more than 27 years ago. Well, actually, I'm the chairman for the next 2 years, and it's special and probably a great mission for me to federate and to work on this very interesting area.
Congratulations for that, Doctor. It's a real pleasure to see a Moroccan taking the lead for the next coming 2 years within all the skills and the professions around. Yeah. When we speak about the Moroccan Society of Reproductive Medicine and Fetal Medicine, what does it consist? For example, do you meet? Do you come up with new ideas, new ways? Do you improve the medicine? What do you guys do?
A lot of all these things, you know. And the first thing we did, which was actually probably a reference in Morocco, we did a study in Morocco. The first time when I came, we founded and I was the president, I talked to the board and I told them, well, the first thing to have is to have a diaporama of Moroccan issue of infertility. It was one of the first ones that had been done in all over the world as a trial, as a study in the 16 regions of Morocco. And that gave us, you know, like a starting insight to make a real agenda to work for this problem. In Morocco, we have around 12% of people that had an issue of infertility. Just to give you an idea, a clear idea, more than 1.8 million of Moroccans suffer from infertility. And we know how is our society. We have a special society that never forgives. When you get married with the parents, with the family, with the friends.
Everyone is expecting for you to have a kid.
For you to have a kids.
Yep.
And that's why it's have a real negative impact on the society, on these couples, 1.8 million. So we decided to work on this field first to develop medical education, because in Morocco in the university, we have around 2 hours studying infertility, which is really not enough at all. And also general physicians and also OBGYNs are not very aware of this special field. It's a real specialty, you know, much different than the OBGYN, than the pregnancy and other probably things we do as an OBGYN. So we developed education. We were the first probably Moroccan medical society who organized English, 100% English congresses. That was crazy at the beginning. Everybody told me, well, you're crazy to do that and you will not have nobody assisting in your conferences. Even you bring the best and the most known infertility specialists in the world. They were here, they came because I have a lot of, relationships with them. We published many data, many articles, with some international known speakers. But we were really surprised, but honestly, well surprised.
By the level of participation.
The level of participations.
Yeah.
And year after year, people didn't always also use the translator. At the beginning, you have almost 80 to 85% of participants who needed and asked for the translation, the simultaneous live translation. In our last Congress, we have had more than 750 participants. Mostly 10% to 15% had the live translation, which is probably a good thing. People are more engaged in English, and this is the scientific language.
Absolutely. Yep.
French, as I say, is a myth.
Yep.
Actually, we should forget.
Yep.
French country and probably French language.
Absolutely.
Well, this is an extreme idea, but I'm sure that English is probably the best way for doctors, physicians, to have a better education in their fields. So we do also a lot of workshops for training, for physicians, general physicians, for specialists, for embryologists, because it's a very, very difficult field to be an embryologist. And we're trying to develop also a special certification with ISHRA, with the European Society. I have some contacts, and we'll probably push the Moroccan embryologists to be certified. That will give really a guarantee for infertile patients to be treated in the best way in the IVF clinics in Morocco.
I think you guys bring in the best practices through the society, and you're organizing this Congress. So you bring in some of the best leaders around the world in the same field, and you're sharing ideas. Then you taking all those ideas and you're practicing them into Morocco. This actually will drive me to one question. When you actually put all those elements together since the creation of the society, have you noticed any impact on the level of reproductivity in Morocco? Has it been decreased? Have you seen an impact in the field?
Well, my first word will be, I hope. We already do our best. We do a lot of efforts. I think, well, the other people should tell you that. I'm not in the good position to say that, because even if I put my ego on the side, but I think when I see discussions within the congresses, for example, when I see people coming for training and coming back a few years later, we see that the competences are getting much better, much higher in this field. And my first fight,
basically,
was to convince people, infertile people, as also people who had any medical issue, to go outside Morocco to have any treatment.
Yep.
That's a shame. That was a shame for us. We have enough competencies. We have enough clinics. We have enough
equipment.
We have enough very competent doctors and physicians, and also surgeons, embryologists, to keep these people here in Morocco and to get treated here near their family, near their home. And I think we are a little bit beginning to succeed.
Very good.
Few people actually have this bad idea that we should go abroad to have the best treatment, to have the best doctors, etc. And I cannot do it alone. I think that we all physicians, all experts in their fields are starting to do it. We have very good experts in all the fields of the medical specialties.
Do you have any collaboration between the society and the Minister of Healthcare? and the Minister of Health in Morocco?
Sure.
Yep.
Actually, we are working first on the new law. Since 2 years, we started to have a law, reproductive medicine, and we asked for it since more than a decade. We needed, and good and clean environment where to work, because it's very special field. There is a lot. The line should be well designated, well known, not to be out of law.
Yep.
So this was important.
Yep.
And actually we are working with the Ministry of Health to make it on paper. Each law needs to be, I don't know how they call it I'm not very aware of politics, but we work together to develop these fields for each law as a reference that could be taken as a reference for the ministry. Like, for example, how an embryology lab should be equipped, how should we give an agreement to a physician to do IVF, for example, how to do medical education for embryologists in embryology, etc. This is very important fields. We work and we cooperate with the minister to develop it.
Very good. I believe that Morocco is leading the way in many sectors. Medicine now, it's actually one of them. And you are elected as a president of this Mediterranean Society. It's Mediterranean Society to tell the audience. It's called basically Mediterranean Society of Reproductive Medicine, which is this similar to the Moroccan one, but it's a bigger scale for the Mediterranean. You are the chairman now. And it's a proof of that, because we can say it's black on white. You have been elected as a chairman. What does it take to be elected as a president or as a chairman?
Well, as any international society, medical society, you should have a project, and you should convince all the board. We are 21 countries and we are 21 members that every 2 years want to get chairman, and I was chairman-elect since 3 years. I was elected 3 years ago, in the international societies. You have the chairman-elect, you are elected to be the next chairman, And because of the COVID, we waited till last month to get elected to be the real chairman of the Mediterranean Society. So I had a project, and I had to convince all the board members and all the countries, the representative, that I can lead this important society for the next 2 years. And my project was based essentially on medical education for probably the south countries of the Mediterranean area, because we are not very organized as a regional medical society for the countries from Morocco, Algeria, Tunisia, Syria, Iraq, Lebanon, etc. We have almost 12 countries, plus countries from the east of Europe, like Serbia, like Montenegro. They're not really active or following the European society.
Okay.
So we are working on a handbook. That's not a secret, but where I will be the editor-in-chief for this handbook. That will be a reference manual handbook for the training for a young physician, for young embryologists. We already signed an agreement with Springer. Springer is the most important edition company for medical journals. So we just signed this agreement, and I'm happy to be editor-in-chief for this handbook. And we are working on many randomized control trials that will be probably references in all these fields internationally. We are working on 4 very interesting fields that have many issues like repeated implantation failure, that patient for whom IVF does not succeed for several times. We have some interesting research on that. Also for some other issues in infertile patients. So that would be probably the first time as if I succeed as a chairman, but we are working hardly on it. And we want to also input a diploma, because there is no diploma for this area in reproductive medicine. So, and the handbook will be probably a manual as a reference for the diploma. So that are probably the most important challenges in my election for this next 2 years. And well, that's an honor, but that's also a
big task, a big responsibility.
A big responsibility, but well, I like challenges. I'm a challenger person, and in all my life, I worked with the challenges, so that's fun.
When we speak about the education curriculum for medicine, and we know we have the generalists, then they move up to specialists in a certain field. Are you thinking from the society to integrate some of those best practices to the specialty? That means, for example, the handbook, the best practices that you guys will integrate. Will that be integrated to the curriculum or the training and competencies of specialties within the universities?
Well, I hope we are open to work with the universities. You know, in Morocco, universities are the only structures, if you want, that can give a diploma or that can integrate some practices. We are in discussion with some private and also public medical universities in Casablanca, also in Marrakesh. And we really want to integrate a lot of these tasks in medical education for students and also for general physicians and also for specialists. I have a hope that public hospitals should integrate IVF clinics, IVF centers that will probably give more visibility for this kind of treatments, because a lot of Moroccans don't know that it exists, unfortunately. And in 2015, when we did this study, more than 37 or 38% of the population were not aware of the existence of any ART, assisted reproductive treatment, which is unbelievable. In 2022, you know, the first baby born by IVF in England by Bob Steptoe was born in 1978. She's actually 44 years old. So actually it should be a part of the medical rights for this kind of population, for Moroccan people. And we are working on it, because last year we could have the coverage, insurance coverage for drugs, for some drugs, not all. We hope that all should be reimbursed. And we need also the coverage, medical insurance for the attempts for the IVF. It costs a lot for the mean income of our Moroccan society. And that's probably doesn't allow many thousands or hundreds of thousands people to not have this luck to have a baby. So that's one also of the things we are fighting.
While you're speaking, Professor, I'm trying to put the pieces together and trying to get in mind what could be quite interesting by your society to Morocco. Are you speaking to any other societies by sharing some best practices? For example, when we speak about the Moroccan Society for Reproductive Medicine, do you share your best practices with other society, for example? I mean, we talk about other specialties that could be neurochirurgical or any other societies in Morocco. Do you have that link and that contact between the other societies?
We have some contact for sure with some societies that can impact our practice. For example, with the oncologists. Actually, we know that the chemotherapy and radiations can very heavily impact the reproductive outcome for patients, for female and males. And we're trying to convince them that actually this kind of population that can be treated. When we talk about breast cancer, actually more than 85%, and we just left the pink October for the breast cancer, and more than 85% can be treated. But we should talk about quality of life. And what is quality of life? Is to be in good health, to have a baby or two babies, and to be socially integrated, etc. And
mentally stable as well. And mentally stable.
And mentally stable. It's very important for sure.
Yep.
So actually we can preserve fertility. We can preserve oocytes for this kind of patients. And we made a lot of meetings with oncologists to convince them that they can send this kind of patients for 2 or maximum 4 weeks to let them freeze their oocytes, because after a year with chemotherapy they can get in menopause and they could burn all their chances to get pregnant. So if she freezes her oocyte, that means that will give her a real chance to get pregnant, to have a baby, once she will be treated, when she'll finish all her treatment. So we are trying to develop these good practices or these best practices with the other societies. It's not always easy, but it needs time, and our mission is to push them to succeed. We have also meetings with radiologists as a society of fetal medicine also. So we try to develop the good competences in ultrasound, especially for pregnancy, for obstetric outcomes. So we are developing also with international societies some training workshop for ultrasound, for fetal ultrasound, and also with pediatricians, because they get our product, the final product, which is the baby after IVF, after reproductive surgery, etc. So we have also some meetings with them and some discussions to have them to speak the same words, to say the same things to patients and to people, and also to be able to develop common competences in this field.
I think it's the last question that I will ask you, doctor. I don't want to hold you any longer. We can see that you are extremely busy and solicited from Morocco with your patients, and as well with the local association and with your new responsibilities. Before we can release you, if there is one dream that you wish for Morocco and for the Moroccan medicine, what will that be?
Well, my dream for Morocco, I'm very patriot, and I want Morocco to be probably the best country in the world as a quality of life, and the Moroccans deserve it. And my second dream is on my field, and to let people, infertile people that have a lot, that suffer a lot, to get chances, really good chances to get pregnant, and especially with insurance coverage. That's not a huge dream. That's a basic dream, but I think that it will change a lot for 1.8 million of Moroccans. And thank you.
Thank you very much, Doctor. I think His Majesty the King Mohammed VI has already started that field by trying to integrate actually social medical to majority, and now we are looking at the project just to keep the audience actually as well aware of. Especially sometimes we have some audience that listen to us from abroad, or Moroccans that live in either in US, etc., to be quite linked to Morocco. There is a lot of things being done by all levels, and it's a big project to integrate everybody.
It's a huge step to let more than 85% of Moroccans to have medical
dignity,
insurance and dignity.
That's really dignity for Moroccans.
That's
what we can call it. Yep, we cannot call it more than that. Well, Professor Omar SEFRIOUI, thank you very much for attending Good Morning Morocco. We wish you all the best in your new role, and thank you for taking the time to be here with us. And we would like as well to thank you for taking the Moroccan medicine reputation to the international community.
It's my duty, and once again, thank you for inviting me. And I will hope a great success for your for new radio, and I'm sure that it will be very successful.
Thank you very much, Doctor. Ladies and gentlemen, this was Good Morning Morocco with Jalal, Jihazi, and Professor Omar SEFRIOUI. Stay tuned on our program, and we will be back after the music break.